Hello everyone, welcome to Let's Talk Diabetes with Nkirika. So today I'm going to be discussing tight glucose control and what doctors won't tell you. So the first question that I'm going to ask today is tighter always better when it comes to blood sugar control? This is really food for thought. So if you're managing diabetes, I'm sure that you've probably been told to always keep your blood glucose levels as low as possible. But could that advice actually be doing more harm than good? Well, for me, it did the both. So it did good in curbing my secondary complications and keeping my blood sugar levels in target range. But on the other hand, the harm that it caused was me losing my hypo awareness and having diabetes burnout and some form of mental breakdown because I was just overly focused on my blood sugar control. That I was totally focused on numbers, and wanting it to be in target range at all times. So the second question I'll be asking, what is tight glucose control? This simply means just keeping your blood sugar levels like close to normal, usually aiming for HbA1c below 6.5 or even 6. This actually sounds good, right? Lower is better, right? Let's talk about the hidden dangers of keeping your blood glucose levels in target range, as in a very tight target range. Number one, it doesn't always happen, but here's what most people and even doctors don't talk about. Number one, severe and frequent hypoglycemia. I can attest to this. I had severe and frequent hypos because of my overly tight control. And number two, burnout and stress. Oh yes, I had this as well. Burnout and stress. So this was me. I was chasing like perfect numbers. It really affected me like mentally. I was just not myself. All I was focused on was, oh, I needed to get these blood sugar levels in target range all the time. And for older adults, if you're older and you're living with cardiovascular diseases, this overly strict control might actually increase your risk of complications instead of reducing them. So my third question is, what good diabetes management actually, well, it's not a question, it's a fact. So what does good diabetes management actually mean? So this is all about balance. There's no need for perfection. We just need balance. So for the balancing act, we have to avoid dangerous low blood sugar levels. We have to enjoy, you need to enjoy your life with diabetes without any form of fear. And reducing complications safely is something also that needs to be at the back of your head. So you are not being overly focused on the numbers, and at the same time you are also trying to reduce your risk of developing complications. So this is like a balancing act. So for some people, you can have a target HbA1c for 7, 7.5, or even 8, and this is okay. Next time you meet with your healthcare provider, could you kindly ask them the following questions? So the first thing you must ask is, what is a safe, realistic glucose target for me as an individual? You cannot have a target range that is generalized. Everybody has a realistic and safe glucose target range. For me, recently, because of my hypo unawareness, my glucose target range was increased to 8 millimole per liter for my blood sugar readings pre and before meals. And this has really helped me. to start getting my awareness like slowly. So every individual living with diabetes has a realistic and safe target range. So you must ask your health provider. And then the next question you should ask your healthcare provider when you go to see them is, how can I prevent frequent highs and lows? So this is all about education and you developing a routine that sits with your lifestyle. And then the third question is, what's the plan if I start feeling burnout? This is something that we rarely discuss with our healthcare providers, and it is very important that you sit and discuss and create room just in case you feel this burnout. So now, my final thoughts and my call to action. Diabetes, it's not a mathematics problem. Please, it's not. I know it involves a lot of math, but it is more of a lifelong balancing act. I repeat, diabetes isn't a math problem, but it's a lifelong balancing act. So you don't need perfect numbers. I have learned that gone are the days when I was striving for perfection. You just need a plan that works for you as an individual. Like this video if you learned something new. Subscribe for real life lived experience health tips on diabetes, and drop your HbA1c goals in the comments, and let's talk about what good control means. Mine is HbA1c of 7%, and I am happy with that. So guys, I'll be looking forward to your comments in the comment section. Bye.